Hi, everyone. I'm excited to be here, and I have, in part because this is a new endeavor for One Day, One Week, and also because we have my dear friend, Dr. Valerie Williams Sanchez. And she's been so kind and gracious to agree to take part in this, and I'm looking forward to this, as well as the many guests that will be a part of the One Day, One Week new podcast series. So what do I say about Valerie? I've known Valerie for 25 years. Hard to believe. I know. Oh my gosh. It's been quite a while. And for the first time, Valerie and I met, we just connected. We're deep thinkers. We have a lot of breadth and depth to how we think, what we think about life, the world. We met at a healthcare company called Medical Data International, and she was a writer there. And I'm gonna outline a little bit for you her background, and then we'll get into some conversation, and we'll go from there. So, and forgive me if I'm reading a little bit, but I don't have a teleprompter in my studio
yet.
Yeah, that's right. Try and fit it up here. So Valerie is a healthcare literacy and marketing communications consultant. Now, she has decades of professional experience, and including more than 10 years of healthcare and medical marketing and communications experience. And that led to her most recent accomplishment, receiving her PhD from St. John's University, and we'll get into more of that. Early in her career, Valerie was on board for periods of time with the Miami Herald, the LA Times, and as well as I mentioned, International Medical Data International. And then from there, she went into a family endeavor called the Williams Institute, which I know will play a part a bit, at least in our discussion today.
Yeah.
And from there on to Columbia University, where she was communications officer. And also then part of Valerina Online, which is where she's been honing her literacy consultancy. Why don't we jump in? How was that? Was that good?
That was great. That was great. That was wonderful. Yeah.
Awesome.
It's funny though. I didn't realize we've been friends for such a long time. And it's true, all that you've characterized of our conversation and our relationship. So it's wonderful. It's an honor, and I'm so pleased to be part of your new endeavor. I'm so proud of you.
Well, thank you. Well, it's a thrill that we're here 25 years later being able to do this.
Who knew?
Absolutely, absolutely. Yeah. I guess the first part, if you can just give a brief overview of life, where you're from originally. I touched on the education. Tell me just a little bit about that at a high level. We can get into more details as we're going along. A little bit more about your current professional endeavors. And then a little bit about your personal journey, which, we've talked about.
Yeah, sure. So just as you mentioned, a little bit about me. I'm originally from Southern California. As you know, that's where we met in Irvine, in Orange County, California, in fact. I grew up there, and upon finishing high school, I went off to college at UC Berkeley up in Northern California. Studied there, and in my junior year, I went and lived abroad in Spain. I attended the Universidad de Salamanca, as they say. So after living and working in Spain for a stint, I returned stateside and applied and attended the Graduate School of Journalism at Columbia University. But then I decided to start a family. And so some of the challenges of being a daily reporter, which for me included covering crime, became a little bit too I'm a bit risk adverse when I was pregnant. And so I decided maybe I should kind of find something that's a little bit more tame. And in that regard, that's when I switched to marketing communications. And as Todd has described, I went to work for Medical Data International. And that's when you and I met, because it was when the business industry was really taking over healthcare. So there were so many changes just in terms of the way healthcare was provided, the way it was imagined, the way it was structured, that made it a really exciting time. Now, I decided to pursue literacy because I found that it offered, for one, it was like a natural. I didn't know much about the discipline, but it was upon talking with some of the professors and students as part of my kind of enrollment process that I learned so much about literacy. And I found that it was such a natural fit with everything that I was passionate about, all the work that I'd been doing. And it made such perfect sense that it was kind of like, wow, how did I not know about this, sooner? But it prompted me to enroll in the program. And in January of 2021, I completed my PhD. And the benefit of doing work in literacy is that it's not just reading literacy for children. Literacy is a very broad field. So not only do we talk about the mechanics, which most people are most familiar with, but at the PhD level, you're talking about theory. So when you get into the theory of literacies, and you can think of all the many literacies there are: financial literacy, health literacy, media literacy, digital literacy, there's a literacy component. And my studies have kind of prepared me and bolstered my understanding of those aspects, that I can take them into most any endeavor. I'm currently a consultant for Valerina Online, which is a nickname my grandfather gave me, but it also it signifies my name and my daughter's name, and it's a business I hope to pass on to my daughter, who I mentioned earlier, who's now 25 and married. Wow. But it has been a great opportunity to kind of encapsulate all of the experiences that I've had in terms of literacy, healthcare, marketing communications. And so,
thank you. That was great. I mean, it certainly gives it was a lot, but it could have been longer, could have been shorter. But you know what? It was perfect, because the intention of it was really to set the stage for the breadth and depth of the conversation that we're going to have now, and your personal journey with cancer. And we talked about that, and we talked about just keeping it at a high level. There's no need to go into go into much depth or that you'd like. And then we'll tie it into the whole caregiving, patient advocacy part, because obviously that's 1 day, 1 week. That's what we're about. The questions that I have to start is, prior to your diagnosis, what was your experience with caregiving and patient advocacy?
Prior to my diagnosis, I'd actually cared for my mother, who'd had 2 hip replacements and a knee replacement. And I'd lived through all of that. And that was probably the first real awakening and eye-opening experience that really informed me that having an understanding of healthcare industry, medical procedure, diagnosis, medicine, having those big blocks of knowledge in those spaces doesn't translate to understanding the patient experience or being a good caregiver. There's so many different aspects that don't even come into play as a caregiver that, I found out really quickly that I didn't know anything, or very little.
Yeah, it's very analogous to street smarts versus book smarts.
Exactly.
And
that is exactly right.
And it's so true, because what I have experienced, certainly with my parents over the past 3.5 years, and then prior to that, just having volunteered and worked in senior communities since I was a teenager, I've seen a lot, I've learned a lot. But even to your point, even having been for decades involved in the senior community and going in as a volunteer, seeing caregivers, seeing what patient advocates did, I had no true conception or understanding. I had maybe a conception. I had no true understanding until I was immersed in it. And that holds true for, I'd say, most, if not just about all caregivers, patient advocates. Yeah, definitely.
Yeah. I think that work too has been transformed as well by the industry and the industry changes. I think, I mentioned that my mom had hip replacement. I think earlier in the years ago, let's say, when physicians were more interactive and had more direct and lengthy relationships with their patients, patient advocacy was a totally different thing. Being a caregiver was a totally different thing. It was more about, it's always been about relationship, but the relationship with medicine seemed to have been a more personal one. It's only now that things have become more industrialized and more monetized that, patient advocacy is in and of itself, it's become a career, right? It's become a career path. They've formalized those relationships. They've formalized what that work is. They've really tried to kind of, or I think efforts are ongoing at least, to try and understand the facets of being a good caregiver, right? At least in the professional space. And now, thankfully, and thanks to efforts like yours in the individual and personal space, there are resources to understand and better understand how to do that effectively. But I do think from my experience, that wasn't always so. And it's been as a matter of the transformation of healthcare and the medical industry that this need is surfacing and becoming so much more evident and important.
True. We could go in so many different directions at this point. And maybe we'll have you back on another time.
Sorry.
It would be great.
Mm-hmm.
Because I'm thinking right now, one of the avenues to go, which I think we'll save for another day, which would be the parallels of that with corporate America. And the pressures that corporate America feel towards a bottom line. And so when you have medical care that's within the sphere of corporate America, even if it's a nonprofit per se, it's still bottom line driven. And how does that affect the access to care, the quality of care, the education of care, et cetera, et cetera, et cetera, the literacy of care. So that's a great conversation. Definitely we could have at some point.
Episode 3.
Yeah, absolutely. After your diagnosis, and now you're going through your experience, how did that change your, well, number one, how did you receive caregiving and or patient advocacy? And how did it change your perception of it now that you were on the patient side of it?
Okay. So, I mean, this is great space to kind of explore. So for me, my diagnosis, first off, and I mentioned, I'm a writer, so blogging became my lifeline through my process. So I've done a lot of like personal narrative kind of memoir writing about my experience. And I think when I was diagnosed, and it was a tremendously difficult. I mean, it was just difficult. I was in my 40s, and I was being told that I had breast cancer. And I think for most, no one believes that it's going to happen to them. To have that be told to me, and I was in for my routine mammogram, as everyone's told to do. You do your annual mammogram. Okay. So I was like, the physician was telling me, I'm like, yeah, well, here's my situation. Because everybody has peculiarities to their bodies, and they know their bodies. They know what they're going to get because you've been doing it for so many years. And I was like, oh, yeah, I know this, that, and the other. And they're like, yeah, no, this is different. And I'm like, what? They're like, yeah, this is different. This is suspicious. That I remember that word took on new meaning for me. There's something, it's suspicious. I'm like, what does it mean? I mean, that is, to me, the ambiguity of suspicion. It's like, well, is that a yes or a no? Or what is that? And really threw me into quite a bit of a tailspin. So I found I ended up in a very suspicious space for the next 3 to 5 years. Everything was suspicious. Everything was not finite. Everything had nuance. It was alien to me. It was all of a sudden words that I thought I knew what they meant, had new meaning and new significance for sure in my life. And that was really kind of the from the point of diagnosis all the way through the end of my treatment and to my now survivor status has been shaded by nuances of being suspicious, nuances of ambiguity, if you will, that I've had to really navigate. And that navigation process has been an education, and it has it's been a mixed bag, to be honest. Someone who's fiercely independent, and this is the thing I really wanted to get into, and particularly for people of color, and Black women, fiercely independent because we've had to be, not necessarily because we've always wanted to be, but the notion that you are the only one looking out for yourself, that comes into play in this health space in ways that you can't imagine. So you've for someone who's been, socialized to be their own best advocate, to fight fiercely for themselves, sometimes those fights aren't the fight you think they are. because the world of healthcare and medicine is a very different space, and they don't see people of color in the same way. We talk about the history of Black health, right? We talk of the Henrietta Lacks. I mean, I think increasingly those stories have surfaced in the general population, and people are starting to understand that when Black people are saying, we don't trust this stuff, we have good reason not to trust this stuff. When people are learning about Henrietta Lacks, they're learning about the Tuskegee Project, they're learning about the ways in which, Black bodies have been basically, I'm not even commoditized, but just used for research, used for medical advancement, used for, you need a body, you need a vessel, you need a cadaver, you need a limb, seriously. A lot of those realities kind of surface in strange ways as you're going through. You see yourself as, I don't know, you're not a person. It's dehumanizing in many ways. And so that was part of my journey, was learning when to fight, how to fight, and how to kind of assert myself in the patient space with health advocates and as an advocate for myself in the health space.
While you were going through all of this, were you the primary advocate and the primary, did you have a caregiver? Did you have help from family, friends as a caregiver aside? Wow, I didn't know.
My whole family, oh, you didn't know that. My whole family's in Southern California, and I was here. And my fiance, Edwin, he was the only one that was there on a daily basis, coming to appointments with me, watching me, helping me, going to these, and I was the one talking directly with my doctors. And I had most people, if you get a diagnosis like this, you have multiple doctors. I had a radiologist, I had my chemotherapy physician, I had my surgeon, I had my the surgeon who diagnosed me, I had the oncologist who I worked with follow-up. You have a cadre of people that you're interacting with. Yes. Who have specializations, and they have a specialized sense of what they're doing and what they need to do, and you have to learn this.
I'm relating this certainly to my parents' experiences, and I'm grateful that I could be here to help them through it, and I have this conversation all the time. All the time, every week, at least once a week with somebody. Mm-hmm. And I'm dealing with it all the time. Yesterday, it was another example. You have all of these, there are some wonderful physicians out there. Truly great clinicians. Sure. And then you run into the communication aspect of it. And who's communicating with who? Who's the quarterback on this? You have all these, well, this is my silo, and this is my silo, and this is my silo. Well, who's the quarterback? Unfortunately, to a great extent, we as either the patient or the patient advocate have to be the quarterback. So as much as we've been fortunate in our lives in terms of education and career-wise to be able to learn a lot, even we aren't ready for that.
Right.
We then have to, we're fortunate because we know how to put pieces together. We have that fearless aspect where, hey, Doc, we're going to ask you this question, Doc. If you're not answering, we're going to ask it again and again.
Right.
Get the answers. But this is part of the health literacy part that I wanted to talk about, because this is the challenge. And certainly for people of color, people all over, it doesn't matter race, religion, creed, color, ever, the health literacy component is a huge part, because people don't know. Just like you said, you were hit, you went from your mammogram and you heard this, and then it's like, whoa, you're now transported into this whole other universe.
Exactly.
And it's not only you're transported into the healthcare universe, you're now dealing with not only whatever health issue you have going inside of you, but you now have your thoughts and your emotions and everything coming up. So to try and deal with this all at once, it's overwhelming for patients.
It really is.
So as the patient advocate, you really have to think through this process, and you have to do your research, you have to understand, you have to, but how do people, and I'd love your thoughts on this, having gone through what you've gone through, having on a personal side, but also the professional side, and through your PhD. The challenge is for people, people can research and learn about a diagnosis. But we know there's so many nuances, as you were saying, everybody's body's different, everybody's situation's different. It's really, if there's one thing, and it's hard to pick one, but if there was one thing that I could hand to people who are going through this, or to their patient advocates / caregivers, they may be the one and the same, is the courage and the confidence to keep asking questions. Don't just take the answer that is there. It may be right, it may be partially right, it may not be right at all. But we have to understand from the physician side and from the healthcare provider side, I believe they all have good hearts. I do. They're so overwhelmed, and this touches into what we mentioned a little bit before, where that's a whole other session.
Right.
They have hundreds and hundreds and hundreds of patients, so it's tough enough for us with one person that we're caring about, whether it's ourselves or if we're a loved one. They have hundreds to try and keep on top of that, let alone their personal lives. So that's why it's really important. So anyway, I'm now rambling, but I'd love your thoughts on that.
You're not rambling, because I think everything you said is really true. Personality sometimes has a lot to do with our comfort level with having the confidence and the tenacity that you really need to get good care, because you have to ask questions in these new spaces because you don't know, and you have to know not to be self-conscious when you're asking these questions, because at the end of the day, it's your health and your health outcome. That's really the biggest challenge, I think, for all of us. For me, caring for my care, my advocacy was not just about my health. It was the financial aspects, because I had to managed all the financial part of it. How am I paying for all my bills? I actually had to keep working through some of mine, because I had all of the different levels of treatment and care. So I was still working, and this was, pre-Obamacare. People don't really understand kind of what my journey was, but part of the reason why I stayed in the East Coast versus the West Coast was that I had to stay in my job so that I had my health care to pay for my treatments. So that meant I had to stay on the East Coast while everyone I knew, for the most part, was on the West Coast. Right. What you're talking about, asking those questions, it's as exhausting, it's as daunting sometimes as the care itself.
Yes.
But keeping your spirits up to continue to ask the questions, to look for the answers, and to seek out resources. I think for breast cancer, we're fortunate that there are a lot of resources out there. I think because there's so many people affected by the disease, that there's so much awareness. There's so many resources out there that it helps. I can't say it makes it easy, because nothing's easy about cancer, but I definitely feel that, finding good groups, support groups, if you can, or if you feel that's the route you need to go. Because I did that for a while. Then I got to the point where I was like, okay, I got to get away. I got to get out of this space. My sanity and my healing and my progress depends on me looking towards normalcy as opposed to being in that space. But when I was in that space, it was hugely, I can't overstate how important that support was. And I think that's one of the things that advocates need, and that's, again, why I'm so happy to see you doing what you're doing. For a patient advocate who is themselves the patient, having that support is great. Having someone to say, I'm having a tough day, or I'm looking for this resource, or I've run out of options. Just having someone to hear, to listen, that's therapeutic. And that's for my literacy education, that I know that being seen and being heard, that's core and central to the therapeutic process. And the therapeutic process is about healing. So having advocates and advocacy around you is really, really important.
It is. I think about this all the time because I live it. And I, I'm constantly I'm amazed that people, it saddens me that so many people, the great majority of people, do not have a patient advocate. They have to be their own patient advocate. And that's often why, if they don't have the knowledge, they have the courage because they're going through it. But if they don't have the tenacity or the confidence to ask questions, because, get a second opinion, get a third opinion if you need. Let's have more than one. From a patient advocacy standpoint, when you don't have that, think about, just what you're dealing with from a healthcare perspective. You also have to do the patient advocacy and do all of that and do all the research. So you're like double, triple, quadruple whammy.
Exactly.
And it's tiring enough from just the physical healthcare aspect and the mental. Yeah. It's tremendous. And that's my wish, is to have a formalized patient advocacy system in this country. I think healthcare outcomes would be better. I think it would bring down the cost of healthcare tremendously. How we get there, that's a whole other conversation.
Yeah.
That's a whole other avenue to go.
Yeah.
For sure.
I totally agree with you. I think, each person comes to their, their health experience and their healthcare journey with different attributes, right? There are things that people know and don't know, or people who are more comfortable approaching problems, or so finding solutions in different ways. And I think, a patient advocacy layer in healthcare that could meet people where they are would be tremendously helpful.
If you have a physician who doesn't have the bedside manner that most suits your personality, don't be afraid to ask for someone else. Don't be afraid to ask for someone who can actually engage with you in a way that puts you at ease, because it's bad enough you're sick. You're going to be sick and trying to get information and trying to connect with someone who's going to be giving you, and many times, life-saving care. You can't be shy in those times, and you can't necessarily be concerned about being polite or how you'll come off, or I don't want to sound stupid. Sound stupid. Who cares about sounding stupid? You want to be alive and healthy.
Absolutely. Right? The best teachers I ever had said there are no stupid questions.
Exactly.
And magnify, as you alluded to, magnify that when it comes to your health and your life. Now, certainly we realize and we recognize that not everybody has the gumption to ask those questions and so forth, because they may be just totally overwhelmed. It may not have been a part of them to begin with. So that's why part of the education through the writing that I do on the blog and that I do when I speak to people, and we'll be doing with these podcasts, and then a couple of other features that we'll be adding over the course of the next 6 months or so, is trying to help people understand that you have a voice and you're allowed to have that voice.
You're allowed to have that voice.
Allowed to have that voice, right? It is so, so important. One of the things I put at the end of each of my blog posts, except this last week, no matter what it's on, is the American Hospital Association's Patient Bill of Rights, because I believe everybody should read that, because it really helped. I think it'll help people. I'd love 100% to go, wow, okay, I get this. I'm going to go ask questions. I'm going to be there. I can do everything. Now, I know that's unrealistic, but if it can move the needle in that direction for whatever percentage of those people, that's more than there are today. And that's more people that can get the better healthcare, can feel more comfortable with where they're going and so forth. So that's part of my mission, is absolutely to let people know it's okay.
And I think that the really important thing of that is that it's a co-created kind of experience, right? I think, having an awareness of the patient's Bill of Rights is, critical for the patient. But I think coming at it in a way of co-creation with your healthcare team is probably even more important. You don't want to come at, it's a difficult time, and of course everyone is probably not at their best in these moments, but understanding that these folks are there to work with you and to help you. And you've said this at the top of the podcast, that you believe that everyone who is there as a caregiver is there for the right reason, really trying to help. I think that's the part that's really hard to hold on to when you're sick, right? And you're in a tough spot, or you have someone who's advocating for you. Sometimes it's really difficult to try and see the good or see the best in them, right? So just trying to have that spirit of co-creation, and even sharing that with, coming at the physician or the healthcare provider with that way. Look, I'm trying to understand this, maybe, how you frame up the conversation, how you approach them for help, not questioning them or challenging them as if they're somehow deficient in doing their jobs, because these jobs aren't easy, and a lot of times the folks who do them, they're not necessarily being compensated to the degree they should. To come at these situations with the spirit of, I really appreciate that you're here and I'm really trying to get the best out of this. How can we, what should I ask? Where should I look? These types of approaches, I think, help ultimately everyone to get and achieve the best outcomes possible.
Absolutely. Excellent point. It is, and that might be the point that we leave on today, because that's an amazing point. It is about co-creating the experience. I think having that base of knowledge I emphasize base, because it's a base of knowledge for the patient Bill of Rights. There's so much more to learn, but if we have that basic knowledge and understanding, because that's basically validating people's experience and validating and giving them permission to ask questions, to get information. I think if people read that, it crystallizes it for them, rather than just it being some esoteric concept out there that's like, oh, right, I can ask something, I'm allowed to, or I'm not sure.
Right.
This is part of the American Hospital Association, that they put this out there. All doctors know it. All medical professionals know it. So it's great to use that as maybe part of a confidence builder for them to go, okay, you know what, I can do this. But your point is so well taken, where it's the co-creation and it's how you approach. And trust me, there's times when I'm challenged with that too. I'm not agreeing with something and I have to have my Zen moment and take a deep breath.
For sure. Yeah.
Sally, I am so thrilled that you joined me here today. This has been fun as always. It feels like we were just having our conversation.
I know, our usual.
As usual. Absolutely. And, I wish you the best of luck now that you are officially PhD and with the literacy. And obviously we will be talking along the way and hearing how things are going. And just thank you so much for your time.
Thank you.
Yes.
Oh, it's been my pleasure, Todd. And I'm so happy to see you doing this. I know your journey has been tremendous with your parents. I mean, there are no words to say how proud I am of you. I mean, saying you're a good son. I mean, I don't know. You're an amazing person to take on all that you have and to take it even further to help others. That's tremendous. And it's worth note and worth acknowledging you for that. So thank you so much for the work that you're doing. And from someone who's also in that health literacy space, this is a tremendous platform that I will do all that I can to help push and get others to be aware of it.
Thank you very much. Well, you have a great rest of the day. Enjoy the rest of your Panera stay. And we will be in touch soon. Right, exactly.
All right. Very good. Thank you. Bye-bye.
Bye.
The primary purpose of the podcast is to educate. While guests are invited to listen, listeners acknowledge that they are not being provided professional advice from the podcast or any guests. One Day, One Week and its sponsor, 17 Commerce LLC, expressly disclaim any and all liability or responsibility for any direct, indirect, incidental, special, consequential, or other damages arising out of any individual's use of, reference to, reliance on, or inability to use the podcast episodes or the information presented in the episodes.